Hi, I'm Dr. Cassie McDonald-Ross with Healing Motion Physical Therapy, and today I'm going to take you through a early postpartum safe exercise routine. What we want to focus on in this phase of our postpartum journey, from about right after birth to 3 weeks, and that timeline is going to look a little bit different for each individual person. But we want to focus on restoring breath, restoring posture, and improving overall mobility of our mid-back area and our shoulders. And so let's get into some of the exercises. The first one is going to be restoring 360-degree breathing pattern. So you can do this in a laying down position. You can do this on your bed or on a yoga mat on the floor. And what you're going to do is you are going to picture your rib cage like an oval. And when you take a deep breath in, you want that rib cage expanding in all 360 degrees. So equally in the front, side, and back expansion. You want to avoid putting too much pressure down into the belly, too much pressure down into the pelvic floor area. You should not feel any bulging in that area. And you want to keep your chest and your shoulder and neck area relaxed as well. So putting your hands on your rib cage is going to be helpful. You're going to take a deep breath in. And on the exhale, you're just gently letting everything kind of recoil. If it feels difficult for you to breathe into your sides, what you can do is you can practice breathing on your side. So you're going to use a pillow or a rolled up towel, and you're going to lay over that. It's just kind of protective to your core in this early postpartum phase. Again, hand on your rib cage, and you're focusing on breathing into the side of your rib cage here. Again, on the exhale, letting everything naturally recoil. Perform that on both sides if you feel like getting side expansion is difficult for you. If you feel like you're struggling to get breath into the back of your rib cage, you can do this in a child's pose position. So the goal of child's pose is going to block the front of your rib cage from expanding too much forward and kind of channel that breath into the back. So use props to make it a little bit more comfortable if you need. If it's difficult to sit on your heels, you can always add a pillow back here, and you can always put a pillow or rolled up towel or something in between your lap and the front of your rib cage. So you're going to come down into child's pose. Okay, you can use a yoga block or something to kind of rest your forehead on if you can't reach all the way down to the floor. You can widen your knees if you feel like you need to create that space. Okay, and then you're going to work on breathing in this position. And you should feel the majority of your breath expanding into kind of the back of that rib cage area. This is a place that gets really, really stiff with pregnancy posturing. So working to create space in that area, again, is important. The next thing that we are going to focus on is stretching out our chest area. So with pregnancy posture, as baby grows out in front, we tend to throw our pelvis forward, arching our back, and then to counterbalance that backward motion, our shoulders round and our head comes forward. So we get really, really tight in this area. And then nursing and all of the things caring for the baby, just kind of reinforce that tightness in the front. So what you're going to do is, again, you're going to lay on your back, knees bent to kind of protect your back. And you are going to lay with your arms in a little bit of like a field goal post position. You can kind of play with raising your arms up or down to kind of optimize how much you feel as far as a stretch goes in this area. If this feels too intense, you have some options. You can put some pillows or towels underneath here to kind of bring the arm up and decrease the amount of tension. You can also work on stretching one side at a time if doing both sides at the same time feels a little bit too intense. And then working from here, we're going to work a little bit on shoulder mobility. And so what we're going to do is we're going to work on sliding our hands up as far as we can without our rib cage wanting to pitch forward and our low back arching. So you're working on trying to keep that good alignment between your rib cage and your pelvis, raising your arms up as far as you can with good alignment, and then bringing them back down. Again, if this is a little bit too intense, performing both arms at the same time, you can work on one arm at a time to kind of lessen that load. So those couple of exercises will really work to help open up the chest and bring that good posture back to the shoulders and neck. The next thing that we're going to do is we're going to work on stretching the hip flexors. So again, with pregnancy posture, our pelvis tends to tip forward as our belly gets bigger and that low back arches. That provides an environment in which our hip flexors can get really, really tight. So one way to stretch your hip flexors is by doing a kneeling hip flexor stretch. When you do this stretch, you want to feel a gentle stretch in the front of the hip. You shouldn't feel any pinching on the other side. And you definitely don't want to feel any back pain or anything like that. So if you're feeling something like that, work on a different modification or a different way of stretching the hip flexor, or make an appointment to see a physical therapist to kind of help you through that. Your foot can be flat like this, or you can turn up on your toes, whichever is more comfortable for you. You can always use a pillow underneath your knee if you feel like you need a little bit of extra cushion. The main component of this stretch is you want to make sure that your shoulder, hip, and knee are all in the same line, okay? And then what you're going to do is you're gently going to tuck and tilt your pelvis backwards, tucking your tail underneath you, okay? Stretching too far forward this way is actually stretching the capsule of the hip joint itself, so we want to avoid that. To get the hip flexor tendons themselves, you're just going to kind of reverse that front tilt of the pelvis by tucking that tail under and feeling a gentle stretch in the front of the hip and maybe down into the thigh a little bit, okay? So you're going to hold that stretch for a good 30 seconds and perform 3 or 4 times on each side. And if you have any questions or if you're finding that you have any pain with any of these exercises, please do reach out to a pelvic floor physical therapist to help you in your recovery.